Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Hassan Mohammed Siddiqui. Today we have with us Dr. Kaukab Azeem from the Physical Education Department faculty in KFUPM. He has done his PhD in physical education. He is also a former gold medalist in All India Intervarsity Best Physique. He is also an international judge in fitness and bodybuilding. He has published many research papers in many journals and has gone through conferences all over the world, including the pre-Olympic Congress in China 2008 and in London 2012. He has a very strong background in fitness and strength training. Thank you for coming, Dr. Kaukab.
You're welcome.
Dr. Kaukab, we have been given a project in our course, POIP Life Skills, and it told us to go through a certain community issue. And after much thinking, we came to the terms that probably we should do about obesity. So how can you define obesity in simple terms?
It is actually excess body fat.
Okay.
And this is a simple word that we use, excess body fat. When you see a person who is having any bulging, abdominal here, and especially if you see in the hip areas,
yes,
you will find most of the fat accumulated in these areas. And to find out this, maybe he is obese or not. But physically, if you see, you can see excess fat, he is obese. But if you want to find out he is obese or not, in detail, we have different techniques actually.
Yes.
But the simple technique is body mass index, BMI.
Yes.
And if he is up to 19.5, he is underweight. 19.6 to 24.9 is average,
Yes.
normal. Yeah. If he is more than 25 to 29.9, he is overweight. 30 plus, he is obese. And morbid, 40 plus. So these is categories of BMI.
Yes.
But for example, when persons are doing some workshops in US, Australia, America, they 2,000 people will attend that workshop.
Yes.
So what they will do, they will not go for BMI or lab testings,
yes,
laboratory testings. There is called pinch test, a simple test.
Okay.
You have to see in the lower abdominal. Pinch test.
Yes.
If it is more than one phalange,
Yes,
that means he is considered to be obese.
okay.
This is a simple test. The facilitator, he will ask to the audience, okay, gentlemen, just check inner lower abdomen, and you can test 2,000 people.
Just in a matter of seconds.
This is, this is not appropriate. We have, as I told you, BMI is there, laboratory test.
Yes.
If you go for the laboratory, they will test, and after that you will find that his fat percentage is more than 25,
Yes.
considered to be obese.
Awesome. Okay, so that is how we define obesity. Now, can you please explain the major causes of obesity, how a person can go to the obese track?
First of all, there is some, chances to be hereditary problems. And the major cause for the youth, for the children, is inactivity. First of all, inactivity. Then the second one, it goes to your diet habits and the poor lifestyle.
How can you define a poor lifestyle as
Poor lifestyle, you don't sleep on time, you don't know how to, have the time for when to, go for the physical activity, when you have to go for sleep, when you have to go for the, your recreation, and when you have to watch television all the time, you're sitting on the television and say, this is not lifestyle.
not organized?
Not organized. You have to be lifestyle.
Yes.
The lifestyle is very important. To control the weight,
Yes.
3 things are very, very important. One is exercise, second one your diet, and third lifestyle. If these 3 things are poor, definitely you have this kind of problems, obesity problems. So, and also the next, if you want to be very precise, we say that your body weight multiplied by 24.
Yes.
For example, a person is 100 kgs. 100 kgs multiplied by 24, 2,400. If he is taking more than 200, 400 calories in a day, maybe he is taking 3000 calories, the 600 calories will be stored in his body. Because he needs only 2400 calories.
Every day?
Every day.
Yes.
So in and out of calories, how much you burn, how much every day you are burning, and how much calories you need it. So this is in and out, you have to be balanced. And the simple calculation says, if you want to lose weight, you have to burn 500 calories every day. If you need 2400, you have to burn 500 calories. That means 1900. So if he's taking 1900 or he's burning 500, definitely his weight will come down.
Yes.
And if you want to increase the weight, plus 500 calories.
Right.
So this is the simple calculation. And you want to find out how much calories you need in a day, your body weight multiplied by 24.
Yes.
So as I told you that if you are 100 kgs, a person 100 kgs, multiplied by 24, he needs 2400 calories. So this is the simple calculation. And in and out, if he has, this one, balance calories, he will never increase his weight.
Yes. So doctor, how long have you been in KFUPM?
This is my 7th year. Actually.
7th year. So you've been in 7 years. You've been in the physical education department,
Yes.
training students and giving physical education courses. If you recall all of that, what would you think? Is obesity really an issue in the students? Say about a majority or minority, but is it an issue to all of us?
Actually, this is a very good question you asked.
Thank you.
And this question is not arises only in KFUPM.
Yeah.
It's not the matter of only KFUPM or Saudi Arabia. Now this is the problem for globalling. I visited Australia in the 27th as per Australian Council for Conference. And they have given literature. 1 out of 4, they are obese. Canada, same problem. Asia, if you see, same problem. It is a global problem. Not only KFUPM, but in KFUPM, yes, we have these problems. Our department, we are trying our level best to facilitate the students.
Yes.
We are trying to give them some handouts. We are facilitating them for some literature. And also we have introduced health education for the students. Yes. What is obesity? What are the causes? What is prevention? What is treatment? And already we have opened the sections for the weight control.
Yes.
We have opened the sections, and the students who are more than 100 kgs, they can go in that sections, and so we are trying our level best. And this is an issue. Yes, it is an issue because we have done earlier some small research, and sorry. 60 to 80% students are overweight and obese.
That's very much.
And this, this is not the challenge or threat. This is not from our KFUPM. From outside, when the students are coming from outside in orientation, you see how many students they are having obesity, overweight. So from the grassroots, actually the schools, they have to think, they have to introduce aerobic activity for the students.
Earlier in their life.
Yes, in the grassroots.
Yes.
Like Chinese, they train their children from the childhood.
Yes.
And when he becomes 13 years, 14 years, he is the Olympic champion.
Yes, exactly.
And when we enter our children, when they are entering, they are 13, 14 years and they are getting retired. So we have to catch in the grassroots. You have to work hard in the grassroots, in the schools. So, but still, we can't say that this is not our problem. This is our problem. We are solving it. And moreover, whenever any student coming to me, definitely I'm helping him. We are, sometimes we have short courses for them. We have, training. Now our building here, 11, we have a very good gymnasium. We have treadmills. We have cross trainers. We have, all the, machines are here, and also the facilities are here very good, the students, but the students also, they should have sufficient knowledge and interest.
Interest. Yes.
And that we are doing, we are encouraging them, motivating them, facilitating them. So.
And everything, and we all know about the harmful effects of obesity, but can you really tell us how harmful it is? How dangerous can it be to a person for our viewers if they're obese and they don't really care about it? Will you tell us how important it is to fight this problem?
It's, as I told you, it's very, very important. From the early, prevention is better than cure. When you get the problems, then you will start walking. When you get the problem, you start, taking medicines. This is not the solution. We have to prevent these things from the early age. Maybe, for example, they say obesity leads for coronary heart disease, high blood pressure, diabetes. So these things in the future, not immediately. For example, some students, they say, from 10, one student, I'm young, doctor, I will not get anything now. So as, we have to convince them, prevention is better than cure. Gentlemen, not now. Maybe in the age of 28, in the age of 30, 35, you will get these problems. So who will be, facing these problems? The students will face this problem. So we have to facilitate, we have to motivate, we have to encourage them to immediately they have to start, they have to do some physical activity, they have to do some exercise, and also they have to, this obese persons and overweight, they have to avoid fatty foods. They have to take 6 meals in a day, small. These things are very, very important.
Yes. Okay. So, doctor, finally, we have all come across many different ideas and habits to how we can reduce obesity, but if you look at it closely, everyone can't follow it. They're too complex or they can't go against the lifestyle. Can you just give us some simple tips as a conclusion that how we can go over this and finish this off?
As I told you before, like first of all, exercise. Second, your diet, balanced diet, and third, your lifestyle. But for exercising, for example, I ask my students, they say, I don't have time. Okay, you can park your car 3 minutes away from your destination, from your building, for example. So 3 minutes you can walk to your class, and again you will walk back 3 minutes. How many classes you have? 4 minutes, 4 classes. 24 minutes you can walk. The simple things I told to students. Don't take the elevator. You can walk through the stairs. You can, get down from the stairs. So this is lifestyle. Yeah, if you do, you can't take a very good diet, but you can avoid the fatty foods.
Yes.
You can avoid at least. So they can take fresh fruits, 4 fruits in a day, at least. And this is really simple. You can take 4 colors, different colors.
Different colors.
Yeah,
that's important.
That is important. And 4 vegetables, different colors.
Okay.
And salads they can take, and they can avoid the oil food, chocolates, ice creams, fast foods, preserved foods. They have to avoid this. At least they should avoid this. And then if they have 1 hour physical activity, involved in basketball, involved in volleyball, involved in training, not matches. Training. Only just practice.
Yes.
Don't play matches. Sometimes matches leads to injuries.
Yes.
So there is a difference between them. They have to concentrate on the 3 exercises. One is aerobics, second one the resistance training and flexibility. This is in triangle.
Yes.
They can't miss anything. Aerobics, it will burn at the same time. Strength training has impact after 24 hours also. When the individual is sleeping, after exercise, weight training, he will burn calories. That's it called muscle tone.
Yes.
So they have to do aerobics, strength training and flexibility. And if you can't do anything, please avoid. Avoid the things.
Avoid the
fatty foods, junk foods,
unhealthy
foods.
Yes.
You have to, and at least in your daily life, you can walk through stairs. You can park your car away from your destination. If these things are adjustable,
these little things will make enough.
100%.
Thank you very much, doctor.
You're welcome.
We really had a good time. Thank you.
That's all.